Today, we're going to tackle something incredibly important. We're talking about a huge issue facing young people, this dual crisis of mental health and substance use. But we're going to focus on how communities are fighting back, not just with hope, but with a really powerful tool, data. So let's get right into it.
Look, the challenge is massive. We're seeing these skyrocketing rates of mental health struggles, and at the same time, a tragic rise in substance overdoses, especially with things like fentanyl. It's like a perfect storm that's hitting an entire generation.
But this is not a story about despair. Not at all. It's actually a story about innovation, and it's a story about action. Because in communities all across the country, a really powerful tool is being put to work to turn the tide.
And that tool is data. I know, when you hear data, you might just think of spreadsheets and charts, right? But what does that actually mean in the real world? How can numbers and patterns actually predict a crisis, empower a community, and yes, literally save a life? Well, that's exactly the question we're digging into today.
Okay, first up, let's look at the high-tech frontier. This is where artificial intelligence is becoming this incredible, powerful ally in the fight for youth mental health. So researchers at Duke Health have developed something that is truly groundbreaking. It's an AI model that basically acts like an early warning system. So instead of waiting for a crisis to happen, it can actually flag which teenagers are at a high risk for serious mental health issues down the road. So how in the world does it work? Well, first, the AI analyzes just a massive amount of data, everything from a kid's social environment to their brain development. Then, a neural network, which is kind of designed to mimic how our brains make connections, sifts through all that info to find these hidden patterns. And here's the game-changing part. It then predicts which kids are most likely to see their mental health worsen within the next year.
And the results? They're pretty incredible. The model was 84% accurate in its predictions. Just imagine a pediatrician being able to see that risk score and step in with preventative care, maybe changing that kid's entire life trajectory. It's huge.
Now, of course, it's not all simple. There are two sides to this coin. The promise is absolutely massive. We're talking earlier diagnoses and getting care to more people. But, as organizations like the NIH point out, we have to be really thoughtful about the challenges. Things like protecting sensitive data, making sure the algorithms aren't biased, and this is key, always having a human expert in the loop. This is a tool to help doctors, not replace them.
Okay, let's shift gears now. We're going from high-tech labs to high-touch communities, where data is being gathered and used by the very people it's meant to help.
This is such a cool story. This is Empower Watsonville, a youth-led group in California. They knew they needed real, current information about what their friends and peers were actually going through with substance use. So what did they do? They took charge. They collected the data themselves.
And their work had a huge impact. You can just feel it in this quote from youth leader Esme Vargas. She says that data was foundational. It gave them the credibility, the leverage, to go to school boards and policymakers and say, hey, this is a real problem, and we have the proof. Now they're using that data to push for more restorative policies, not just punishment.
And check this out. In another part of California, a team saw local data that showed a scary spike in youth overdoses. So they created this Let's Talk toolkit. And they didn't just, post a PDF online and hope for the best. Nope, they mailed a physical copy to the parents of every single incoming ninth grader. Just imagine getting that in the mail. A real tool to how to start these tough but crucial conversations at home.
This quote from Rita Hewitt really just hits the nail on the head. Having their own local data didn't just confirm what they thought was happening. It built trust with schools, it validated their work, it proved they were on the right track, and it made real, targeted actions like that toolkit possible.
So, we've got AI identifying risks and communities gathering data. What comes next? Well, this is where the rubber meets the road. Let's look at how that data leads to real, tangible, life-saving measures right inside our schools.
So in Lake County, a group called SafeRx used their local overdose data to make a really powerful case. They went to officials, showed them the numbers, and successfully pushed for putting naloxone, a medication that can literally reverse an opioid overdose in minutes, directly into their schools.
But you can't just drop a box of naloxone at the school's front desk and call it a day, right? It takes a real plan. Any community wanting to do this has to ask some key questions. Does our state law even allow it? Is the school board on board? Who's going to get trained? Where are we going to store it? And how are we going to pay for it? It's all about creating a clear, thought-out policy.
And once that policy is in place, the training is everything. And this is a great, simple framework to help, the 5 R's. It's a really easy way for school staff to remember the critical steps. You recognize the signs, you respond by calling for help,
You reverse the overdose with naloxone, you support their respirations, and you refer them for follow-up care. Simple and memorable.
Now let's actually walk through how to use it, because it's designed to be incredibly simple, even in a super high-stress moment. So, step 1, you just gently put the tip of the nozzle into one nostril.
And then you just press the plunger. Firmly. That's it. A single press delivers the entire dose. No complicated assembly, nothing to put together. Just 2 simple steps that can save a life.
So we've seen the power of high-tech AI, and we've seen the incredible impact of high-touch community action. So where do we go from here? Well, the path forward, the real magic, happens when we bring these two worlds together.
If there's one thing you take away from all of this, it's this. These are not competing ideas. The most powerful strategy, the one that's going to make the biggest difference, is combining the predictive power of technology with the grounded, trusted action of people in the community.
Think about it this way. The AI can be the smoke detector. It gives you that crucial early warning that a student might be at high risk. But it's the community, the counselors, the youth groups, the trained school staff with naloxone, they're the fire department. They provide the direct prevention, the intervention, and the response. You need both.
And that really brings it all back home, doesn't it? Whether it's a super sophisticated algorithm or a simple survey run by kids, data gives us the power to stop just reacting and start being proactive. So the final question is for you. What's the first data point you could look at to start making a difference right where you live?